Hi, my name is Nick Reese, and this is Sam. We are clinicians here at Complete Physical Therapy, and we want to review mobility of the neck throughout the workday, especially if you're sitting at a desk. One of the things that we want to make sure we're doing before we start working on neck mobility is our good posture check. We're going to brace our core, lift our sternum, draw our shoulder blades gently back, and the chin is in. We're trying to get as close to a neutral position of our spine as we can. The first thing we're going to work on is turning the head, or cervical rotation as we call it. She's going to slowly turn to one side. She's going to make sure she's not turning her entire body. She's just trying to focus on her neck. Once she hits some restriction, she actually turns her eyes in the direction she wants to turn. We'll give her some additional range of motion. We also want to make sure that we're going to the other direction. We want to have equal rotation from left and right, making sure that we're addressing both of those on a regular basis. The other thing we want to improve is side bending of the neck. She's going to slowly draw her ear downward, slow enough that she can feel vertebrae by vertebrae moving. Often if we try to move quickly, the whole neck will stick together and we'll get some side bending of the thoracic spine. We want to really isolate the cervical spine with this. The other thing that we're going to work on is the bending down and extending up motion, flexion extension. She's going to slowly draw her chin down, once again, vertebrae by vertebrae, slowly working through each level as she looks down. When she comes back to neutral to look up, I always encourage patients to lift the sternum to get the upper back as she slowly draws back and up. If we don't and we are kyphotic or forward, we tend to get a pinching at the base of the skull and neck. This way she can clear those joints and make sure that we get this nice clean movement of cervical extension. And these are some nice ways to make sure your neck is not stiff and sore at the end of the workday.